Preservé or not? That is the question. I'm Dr. Victoria Aimé. I'm a board certified plastic surgeon in Scottsdale, Arizona, and today I'm going to talk to you about Motiva's recently branded Preservé breast augmentation technique. Now, this is being marketed as a novel, less invasive way to make a precise breast implant pocket with very little downtime for patients in a plane that is above the muscle. It's supposed to have better outcomes and have less downtime for patients. At least that's how it's marketed. It uses Motiva's proprietary equipment, which you can kind of see here in the background. This is a channel separator. And so basically this is going to go in after the patient's breast has been numbed and move the breast tissue side to side out of the way so it can create a little channel behind the breast tissue in front of the muscle. And once that channel is made, then you can use this device right here. You can see it. Basically, you insert a balloon and you pump up that balloon so it's the same size as the breast implant you want to put in place. And this is where they come up with the precise pocket that is made with very little tissue disruption. Now you can see here, you use a funnel to insert the breast implant into the pocket. Now the idea behind this is actually not novel. It actually comes from hernia repair surgery where they do almost the exact same thing. They use a balloon to expand the space so they have an area to work. So who is the best candidate for this Preservé technique? If you listen to the marketing, they talk about breast augmentation and breast lift patients, but in reality, it's only for first-time breast augmentation patients or first-time lift with an implant or first-time lift augmentation patients. It's not made for patients that already have had a breast implant in place or need a revision. So it's really already narrowing down the market for first-time breast implant patients. This technique is also marketed as having a much smaller incision, along the lines of 2.5 to 3 centimeters. And for reference, we can see what that is in terms of fruit size. So that's about the size of a grape in length. Now, a standard breast augmentation is typically about 4 centimeters, maybe a little bit larger if it's a very large implant. So really, you're not getting so much larger of an incision length. It's really only about 1 centimeter in most patients. So really in terms of length, what you're trading is a walnut versus a grape. Now this very small incision length is limiting in terms of the size of the implant that can be placed through it. So in terms of what Motiva recommends, it's really limited to 150 cc's up to 315 cc's in volume. Now for many patients, that's the perfect size. However, I would say that's not typical. Most patients generally want 300 cc's or more. I would say the average is probably between 300 and 400 cc's. So again, this is going to exclude a fair number of patients that are hoping for a certain volume in terms of implant. And only the ergonomics implant by Motiva can be used with this technique. The reason behind this is that the ergonomics implant by Motiva has more flow to it in the silicone gel inside. It's less form stable, it's less gummy bear-like. So it's not an implant that if you cut it in half, the gel stays inside, it has more flow to it. Now that squishiness or flow to it allows us to make a very small incision and be able to push that implant through without damaging the silicone inside, like would happen with a truly form-stable breast implant. Now, ergonomics implants by themselves are actually very interesting because they are ideally made for patients that have a constriction of the lower breast pole. So that would be a tuberous breast patient or a patient going through gender affirmation surgery, and you want that expansion of the lower pole. This is better than, in the sense, an anatomic or teardrop shaped implant because those have to have texturing on the outside to hold them in place. And also, if they were to rotate for some reason, then they'll look funny. But this one will always reaccommodate because of gravity and because of that flow. Now, the Preservé technique is widely marketed as an above the muscle breast augmentation, and that's not untrue. We are definitely placing the implant above the muscle with this technique. However, where I think it gets a little gray is when people start to call this as subfascial plain breast augmentation. Now, the fascia is a thin layer that sits on top of the muscle. It's pretty adhered down. The way that we get that pocket started is with direct visualization. So we have to actually see it and dissect it with a little cautery to be able to get into that plane. You can't just magically put in that channel separator and balloon open that plane. It doesn't typically work that way. And so I think what is more likely is that this is truly a subglandular plane that most of the time is being made. Now, again, this is a blind technique, so there's no visualization happening. We're just putting in this instrument and ballooning open the space. The other thing that they talk about is that it doesn't cut the muscle. Now, let's remember that you also don't cut the muscle when you do a subfascial breast augmentation, so that in itself is also not unique. Another one of the main points of the marketing is that there's preservation of the nipple sensation with the Preservé technique. But we expect that with any breast augmentation. We know from studying this in our literature that you have about a 5% risk of having your nipple sensation change when a breast augmentation is performed through an incision in the crease below the breast, or the inframammary crease. And that is regardless of the breast implant brand you choose or the plane you put it in. However, if you have the approach or the incision placed around the areola, that is when that risk increases by about 3 times. So this again is not unique to Preservé. This is what we expect with all breast augmentation surgeries. Another angle of the marketing is that the Preservé technique can be performed on a patient who is awake or asleep. Now, any breast augmentation can be done on a patient awake or asleep. Generally, it is safest and most comfortable for patients if a breast implant is placed into the subglandular or subfascial plane. But really, that can be done awake. The way that we do that is we use a fluid called tumescent fluid, same numbing fluid that we use for liposuction. We inject that into the breast area so the patient is numb and comfortable during their awake procedure. Positive to that is it decreases bleeding. It keeps the patient comfortable if they're awake. The downside is that you can't use it with Exparel because they interact. So typically when a patient is asleep, you can use tumescent fluid without the lidocaine in it and still use Exparel. But you can't do that if a patient is awake. You can only have one or the other, and typically a patient needs that tumescent fluid to be able to tolerate the procedure. But again, you can do a breast augmentation on a patient awake without using the Preservé technique. The technique also comes with a premium price tag. I have seen prices as high as $30,000 online for the Preservé breast technique. Now, a component of that is paying for the proprietary system, and that equipment is single use, so it can't be reused again. It's a one-time use. I understand that there is a cost component to that. But the question is, are you paying a premium price for a better experience and a better outcome, or simply for a heavily branded technique with proprietary equipment? What I do think the Preservé breast implant technique does very well is maintaining or preserving the natural structure of the breast. So maintaining these ligaments that you see around the breast up here. That is very important for maintaining an implant in the appropriate position and making sure it doesn't go from side to side or too far down. Malposition, if you will. The last point to be made, I would say, is just a reminder to make sure that your plastic surgeon is in fact a plastic surgeon. This technique does open doors for a lot of non-plastic surgeons to perform breast augmentations, and I think that it's very important to know who is performing your surgery and what their credentials are. But overall, I think that Preservé is a new and interesting technique, definitely not for everybody, but it just presents another option to bring to the table. And I do really like that it has a focus on preserving the natural breast anatomy. If you have any questions or comments, feel free to drop them below.